All right. Hello, everybody. Welcome to our webinar for this evening with Cecilia Health. This particular webinar is called Diabetes 101, Mastering the Essentials. All right, so for this program, our format includes a short presentation followed by an interactive discussion where you'll be able to type questions in if you see the question section, like in the picture here of the webinar toolbar. So at the end, you'll have a chance to ask the questions by typing them in. And, we really look forward to that part of the presentation. So we really encourage you to, ask, whatever comes to mind so we can have a great webinar. Okay, so just some disclaimers. We know that the information you're about to hear may motivate you to make some lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Educator will provide strategies to help manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice that involves the professional opinion of the Cecilia Health Certified Diabetes Educator. All right, and so our presenter today is Michelle Dart, and Michelle began her nursing career almost 30 years ago. She went on to get her master's degree and became a pediatric nurse practitioner. She has over 20 years of experience working with children and adults with diabetes. Michelle became a certified diabetes care and education specialist in 2004 and has maintained her certification all along. Michelle has authored a nursing textbook and self-published diabetes-related books, and has been a contributing author for multiple publications, including the Cecilia Health blog. She fulfills her passion by coaching patients to make lifestyle changes that improve health and quality of life. Michelle has been with Cecilia Health since 2018, and today she would like to support you in some basic self-management of diabetes and overall wellness. So, all right, Michelle, take it away.
Hi, I'm glad everybody was able to come and attend. On the agenda, what we'll plan to discuss will include the following topics. What is diabetes, the diabetes diagnosis, blood sugar monitoring, diabetes medication, diabetes complications and prevention, what to eat with diabetes eating pattern, and then we'll have those questions, answers, and sharing. So the first thing we'll talk about is what is diabetes? We often just hear diabetes, but we don't always know what type of diabetes that we're talking about. Type 2 diabetes is the actual most common form. This is where the body does not use insulin properly. And insulin is like a key that opens up your cells so that you can properly use your nutrition. So when the body doesn't use that insulin properly, and the pancreas might make extra insulin, but eventually can't keep up, um, we'll see that glucose builds up in the blood instead of going into those cells. So when the nutrition can't get into the cells are starved for energy, often leading to fatigue, if you'll run down, as well as some other symptoms. Um, Oftentimes, type 2 diabetes can be treated with lifestyle changes. There are some oral medications. There are some other injectables as well as insulin that is injected. So insulin, off to the side of that picture, you can see insulin is a hormone. that's produced by the pancreas. Like I said, it kind of helps, it opens up those cells so that that sugar, the nutrition from your food can get into those cells where it is then used for energy. Um, just briefly, I will mention type 1 diabetes is another common form of diabetes, and that is an autoimmune form, more often found in childhood, but we are seeing it diagnosed in adults as well, more often these days, actually. So, when thinking about the diagnosis, how do we learn that there is pre-diabetes or a diagnosis of type 2 diabetes? One of the tests would be an A1C, and you'll see in that diagram that this comes in a percentage. The A1C is um, a 3-month blood sugar average, and this is something that is going to help them to determine if there is too much sugar in the system. So the bottom level, if it's less than 5.7%, that's normal. But once we get up above 5.7%, and when we're maybe not as high as over 6.5%, that range is more of a pre-diabetic range. We know that there is an increased risk of developing type 2 diabetes at that point. If that A1C, that average blood sugar, is over 6.5%, then it is going to grant you the diagnosis of type 2 diabetes. Another test would be a fasting plasma glucose. This is where they take the blood from your vein, and this will give you a reading. If it's less than 100, that's normal. If it's between 100 and 126 when you are fasting, which means no food or um, any sugared or carbohydrate fluid. In this range, the diagnosis would be prediabetes. But once it gets over 126 milligrams per deciliter, that is then a diagnosis of diabetes. Another test that you might not hear done as often, but is still done, is the oral glucose tolerance test. A lot of females know about that because it is often done during pregnancy as like a screening. But if there is a question of whether or not there's a diagnosis of diabetes, the oral glucose tolerance test can be done. And this is really giving you a load of carbohydrate to see what happens to your blood sugar with that load of carbohydrate. Um, if after testing the blood sugar is 140 milligrams per deciliter or less, then that is okay. But once we get over 140 to that less than 200 milligram per deciliter range, that's pre-diabetic. Anything over 200 is going to be a diagnosis of diabetes. They typically do test at intervals, but the most common time to see where is that blood sugar at after a load of carbohydrates would be about 2 hours. So a little bit more about the A1C is, like I said, it gives you an average. It's really giving you a picture of that average blood glucose control over the past 2 to 3 months. Our red blood cells live for 2 to 3 months. Any extra sugar is going to cling to those red blood cells. So we can measure how much extra sugar is on those red blood cells. And that is where we come up with that average. EAG is estimated average glucose, or the A1C can represent an average of glucose levels 24 hours a day over a 3-month period. This is including those times when we're less likely to check, such as those post-meal periods where we might have higher blood sugars. So this can be translated, an estimated average blood sugar into a percentage of the A1C, and it's easy to convert. So if you know what your average blood sugar is, you would be able to convert it into an A1C. The SMBG, which is self monitoring blood glucose, measures blood glucose at that one moment in time. And that blood sugar is going to fluctuate from moment to moment. So there's a lot of pieces to that puzzle that we don't see unless we get that average. So, benefits of checking your blood sugar. It does give a good picture of the body's response to your diabetes care plan, what your treatment is, your food choices, your activity level. All of those things are impacting that reading and can help you decide, how is my day-to-day management going? Keeping your blood glucose in range can always prevent or delay those long-term complications. It is especially important to monitor if you take insulin, because we know there's a higher risk for low blood sugars. If you're having a hard time controlling your blood glucose levels, let's say you have, lows, and the next time you check it's over 200, and then you check and it's 60. That's a little bit of a roller coaster. That's hard to control and might require more frequent testing to see what is going on with the blood sugar throughout the day. Having low blood sugars without the usual warning signs. Some people have good symptom recognition. Some people don't experience symptoms, and we call this hypoglycemia unawareness. If you don't typically detect your low blood sugars, and you find when you do monitor your blood sugar that it's low, but you're feeling fine without any symptoms, that's an indication that um, testing more often will help you to catch those lows, maybe prevent a significant episode of hypoglycemia. Um, if you have ketones from high blood sugar levels, that would require more frequent testing. Now, ketones are more commonly found with high blood sugars in somebody with the autoimmune form of diabetes or type 1 diabetes. It doesn't mean that somebody with type 2 diabetes can't develop ketones, but the risk is greater for somebody with type 1 to develop ketones that could advance into what we call diabetic ketoacidosis, which is life threatening. But again, oftentimes providers don't have people with type 2 diabetes monitor ketones, but that might be worth a discussion with your provider should you want to know more about it, and if that might be something that would be helpful for you to have the tools available to test at home. How and when to check your blood sugar. So the how is step by step. Always want to start with clean hands and clean supplies. You wash your hands. When you insert the test strip, that typically triggers that meter to come on and will give you an indicator when it is ready for that blood drop. Using a lancing device with a lancet inside, a fresh one, you should change it with each finger stick. You're going to use that lancing device on the side of your fingertip, not too close to your fingernail, but the side, because it is a little less sensitive. Um, Once you have that injected and a little blood drop, you're going to touch and hold the strip to the drop of blood. It will absorb that drop of blood, and a blood sugar level will appear on your meter display. When would you check your blood sugar? There's different times that can be beneficial. So a fasting blood sugar is usually in the morning before you would have anything to eat or drink that could affect your blood sugar. So this is a good way to see how did things go with the snack I chose last night. We know that bedtime snack can impact that morning blood sugar. Um, Before a meal is going to give you an idea where is your starting point before you eat. And then 2 hours after your meal will help give you an indication of was that a good portion size? Was that a good food choice? What is, the best way to try to adjust it if that blood sugar is out of the range that you're comfortable with? Um, Really, talking with your healthcare provider is going to always be important when talking about your diabetes management. But talking with them about when and how often is going to be beneficial for you to monitor your blood sugar would be a good idea. So if you keep a list of things to ask your provider, that might be one of them. Is how often, what should I do as far as the monitoring of my blood sugar? And making sure you know what kind of results you'd be looking for and what would be worth reporting. So these are some general target ranges. The American Diabetes Association does recommend that the blood glucose be 80 to 130 before meals. And then 2 hours after the start of your meal, we would like to see it below 180. But again, asking your doctor, what are your personal targets? Because they're going to individualize their recommendation based on how long have you had diabetes? How old are you and your other medical conditions? If you have any known cardiovascular disease or advanced microvascular conditions, which we'll talk a little bit more about later, that hypoglycemia unawareness that I previously mentioned, and also just individual patient considerations. We got to take into consideration what is your lifestyle like. How can we fit um, this into your day-to-day routine, and what's a realistic goal for you? Um, so again, a great conversation to have with your provider. Keeping a log. I know a lot of people don't love to keep those written records, and we do often rely on those meters to use that memory to keep track of those blood sugars. And sure, our provider can get that information off of the meter memory, but what about those other details? So, yes, when you do a record, you can do date and time in that blood glucose result. Those are the things that are recorded in your meter. But what about like your meal details, your exercise that day, how you're feeling, any symptoms? Are you tired, stressed, shaky? Um, any symptoms of illness? Things that we know might have an impact on those blood sugars can really help. Having those little notes can help to detect patterns that can help the doctor recommend better treatment options for you. And if you aren't somebody that likes to keep a written record, there are some different smartphone apps. Some that are worth checking out would be the ones that we are showing here: the My Sugar Diabetes Logbook, My Glucose Buddy, On Track Diabetes, Diabetes Tracker, Diabetic Connect, BG Monitor Diabetes. And there might be other ones out there that if you checked them out, you might find you like their format better. But the goal is to be keeping that record and putting in those little details that can help to make better decisions the next time around. Now, how about low blood sugars? Um, Sometimes, like I said, we don't always detect the symptoms, but when you do detect the symptoms, you're quick to check your blood glucose and see where it's at. And what would we consider low? Um, Typically, less than 70 is considered low. Now, some people might actually feel those symptoms before they get to that level of 70. Um, and whether or not to treat those symptoms is another discussion to have with your provider. But if you know that you've been active or you had more insulin than what you might have eaten, um, and you know that that blood sugar might be going down even farther, you might want to do a portion of a treatment. Because if you actually have a blood sugar less than 70, the recommendation is to follow the rule of 15, which is to eat or drink 15 grams of rapid acting carbs. So you can see some options would be half a cup of fruit juice, 5 to 6 ounces of regular soda, which is only about half a can. 8 gummy bears or lifesavers, a tablespoon of sugar or jelly. You can also get those glucose tablets, and you just would want to look at the label closely to see how many tablets are recommended for that particular brand. Once you've had that 15 grams of carbs, you wait 15 minutes and you recheck that blood sugar. If that blood sugar remains less than 70, you're going to repeat those steps. You definitely want to see that blood sugar get up above 70. Um, if you need to treat it more than once, that rapid acting carbohydrate is still important to repeat, and you might want to consider a snack that has some protein in it to help keep the blood sugar up for a longer period of time. And there's your diagram. Eat a meal or a snack within 1 hour, and having some protein in that snack or meal is going to be helpful. So we also want to talk about the medication. With diabetes, yes, many people can manage with diet and exercise, but a lot of times the pancreas just gets tired. And we may need to, no matter how healthy choices you're making, your pancreas gets tired and it just isn't able to keep up with what your body needs. Your provider may recommend adding oral medication, insulin, or other injectable medications. Um, and there's so many options. And so it's a good idea to talk with your provider to see what is going to be the best treatment regimen for you. Looking a little bit closer at the medications with insulin, this is a naturally occurring hormone that our pancreas releases. With type 1 diabetes, again, we don't produce any insulin. Here we say we don't produce enough, but ultimately the body will stop making insulin after there's been an autoimmune process that injures the pancreas so it's not able to make the insulin. With type 2 diabetes, we have a couple things going on. The body doesn't use the insulin properly. It's almost like there's a wall there. This is what we call insulin resistance. So there's a wall there, and you've got all this insulin trying to get through, and it can't. So that is one of the problems. And then just not making enough insulin to keep up with what the body really needs. There are more than 20 types of insulin sold in the United States, which is amazing to me because there was a time where there wasn't nearly that many types of insulin. Now, there are other injectable medications. These medications are really going to affect the body's hormones that help lower the blood sugar. Um, this might be another option to discuss with your provider if you find oral medications aren't as effective. So the oral medications really are only available for those people with type 2 diabetes. People with type 1 diabetes require insulin injections or through a pump. But the oral medications really do work best when used with that healthy nutrition and active lifestyle. It's usually most helpful for people who are newly diagnosed. Um, they also say there's no best pill. Really, there's variety of pills, combination pills. You can take pills plus insulin. There's so many ways to mix and match the different treatments for diabetes. And that's why having that open, honest conversation with your provider, to see what's going to work best for you in your lifestyle. And diabetes complications. So, I mean, one of our main goals is to decrease the risk of those complications, avoid them altogether. But what are they really? We talked earlier about cardiovascular disease and other microvascular diseases. So when we break it down, microvascular is going to be those tiny blood vessels that are affected. This can lead to retinopathy. This is where the little blood vessels in the back of the eyes get weak and can leak and would definitely require treatment to save the vision. That's why the yearly dilated eye exams are so very important. Another microvascular disease is nephropathy, which is what affects the kidneys. The kidney's ability to filter toxins from our system. Um, Often there are no symptoms. So the provider will, if they're following recommendations, monitor the urine for microalbumin, which then tells them how well those kidneys are functioning. There's also neuropathy, which affects the nerves. So elevated blood sugars over a period of time can wear away at this coating that protects our nerves. And when it wears away that coating, it can result in numbness, tingling, burning pain. Um, we most often see that this will happen in the toes and can work its way up the feet. It's really important if you detect any of those symptoms, numbness, tingling, burning pain. It's really important to let your provider know. And it doesn't have to be just in your feet because it can affect other areas. But it is recommended to have a yearly foot exam so that they can really check the sensation, starting right at the tip of your toes. Um, and they can detect it early on if they're able to monitor routinely. Now, macrovascular, which is looking at the bigger blood vessels, this would be cardiovascular disease. So you might see high blood pressure, stroke. Those are things that can also happen if we have elevated blood sugars over a period of time. Now, these are things that people don't typically connect to diabetes specifically. We have to be concerned about the complication of depression. Uh, there's a grieving process with the diagnosis of a chronic illness such as diabetes. So, depression is not uncommon with diabetes or any other chronic illness. Skin disease. There are different rashes and skin issues that can occur with diabetes. So anything out of the ordinary would be worth having your provider look at. Gum problems. So there is increased risk of gum disease. So having a dental checkup every 6 months, if possible, is recommended. And especially if there are any sores in your mouth, you feel like there's tenderness, swelling in your gums, would definitely be worth a dental check. Now, how do we prevent those complications? One of those things is going to be having the best blood sugar control that you can have. Um, Having that A1C check, seeing that provider every 3 to 6 months so we can see how are things going. The goal is typically less than 7 for most people, but your provider may have a more specific A1C goal. Regular checkups, like I said, seeing your provider every 3 to 6 months is important so they can check your feet, your blood pressure, your weight, do routine lab work. That annual dilated eye exam is important. Uh, the risk of smoking, when we know there's risk of cardiovascular disease with diabetes, the risk that increases if you are a smoker. So we know that stopping smoking would be helpful in preventing those complications, but it's not easy. So if you are a smoker, it's a good conversation also to have with your provider. How can I work on um, decreasing the smoking or eliminating the smoking, and see what options might work best for you? Um, some people just stop, which is incredible, but a lot of people need a little assistance and need some help from their healthcare provider. Cholesterol control, blood pressure control, really focusing on that heart health. How do you do that? You have it monitored with those checkups. If you take medication to lower cholesterol or lower the blood pressure, you want to be diligent about taking your medication. And there's a lot of nutrition pieces that can help that cholesterol control and blood pressure control as well. So, what can you eat? Well, in general, everything in moderation is what you can eat. But what are we really going to look at that's going to affect that blood sugar? What do we want to consider to help have the most stable blood sugars that we can? Um, the carbohydrates are what really have an impact on that blood sugar, especially immediately. Um, Consistent carbs at meals and snacks is one way to approach it, where you look at your meal and you see that, geez, I typically have about 30 grams of carbs at lunch. So you want to try to keep your grams of carbs as close to 30 for all of your lunches. Um, and that amount per meal really does vary with individual needs. Um, so that's also going to be specific to you. There's different recommendations based on if you're male or female, where your weight is now. Are you trying to lose weight? Those kind of things would be taken into consideration when the provider says, I would recommend this many carbs at a meal. Um, the amount per meal can vary with individual needs. Uh, the plate method, I think, is an easy visual if you're just starting out, where you can see the diagram on the screen. Half of your plate will be non-starchy vegetables. Then you're going to take the other half of your plate and let's picture that in half. So you only have these other 2 quarters. 1 quarter is going to be your protein, so your lean meat, and the other quarter would be a whole grain or a starchy vegetable. And trying to lay your plate out like that, where it's visual and portion sized in that way, helps to give you a well balanced meal. Now, visiting a registered dietitian is always a good idea. They can look at what are you eating day to day. Are there small areas where you could maybe improve? So maybe you could look at your bedtime snack. Maybe it would be looking at your dinner meal because you like to have a big dessert with it. well, how can we maybe substitute something that helps satisfy that craving for something sweet, but maybe isn't as high in carbs as that dessert you're already having? Um, but really sitting down with a registered dietitian can help you get a better view of what's working for you and what might be worth making an adjustment. And if you're looking for a registered dietitian, there is a website. You can go to www.eatright.org and you would enter the zip code, and that would help you to locate somebody nearby that could be a resource for you. The American Diabetes Association also has their website, which is www.diabetes.org. And they have a whole food and fitness section that might be worth checking out. So we've covered a lot of different things. And I know there was just a brief information about each topic. I'm curious if there are any questions that anybody has. You can use the question tab on your toolbar and type in, any question that you have, or maybe you've got a tip, something that you found has worked for you that would be worth sharing with the group. Um, we're certainly open to any questions or tips, tricks, advice. I know diagnosis time is often the scary time when we're not really sure what is happening or what they might do. Talking with the doctor, letting him know, what symptoms do we tell them about? Some of the symptoms that say that we've got the high blood sugar are going to be excessive thirst, excessive urination. Your mouth gets real dry. So it's like the body wants to get rid of that extra sugar, and you'll urinate. The kidneys are going to push that out to try to get rid of the sugar. And then you end up getting dehydrated, your mouth gets dry, and you need to drink more. So then it sets off this vicious cycle. You might notice that you're having to wake up in the night to use the restroom. You might be feeling run down because you're not getting the benefit of the nutrition that you're eating. Um, some people get headaches. Some people get upset stomachs. There's so many different things that any symptom that you notice is worth sharing with your provider. I know the targets, where should I be as far as my blood sugar and A1C, and um, if I know what my blood sugar is, how do I know what my A1C would be? And there is a nice chart that is available. And for example, let's say you're typically seeing that your blood sugar is around 154. Well, translated as an estimated average glucose into an A1C, that would be equivalent to a 7%. So if your provider says, I'd love for you to be at 7% or less, you know that you want your blood sugars to be averaging around that 154. And that includes before and after meals. A lot of meters, when you turn them on, you can look at the memory and it can give you like a 2-week average, maybe a 30-day average, and you'd be able to get a good idea of where your A1C is at. I'm not really seeing any questions in here. If anybody has anything, I'd love to hear from you. Um, We can talk about there's other live events coming up. Definitely with the holidays, it's a good time to consider that nutrition piece. And November 13th at 5 p.m. Eastern Standard, there is one called Embracing the Holidays Without Deprivation, because we do want to enjoy the holidays. But healthy eating strategies for every festive eater. And there is going to be that available in English and Spanish. And then in December, the topic is Take Control, inspiring tools and tips for becoming your own diabetes coach. So both of those actually sound pretty interesting. So maybe check those out if that's a topic that you might be interested in.
And Michelle, there has been a question that has come through while you were talking about those. I'll go ahead and just read it to you. It says, "What about us guys who are not on insulin or medication?"
Oh, well, that is a great question. Um, so if you are not taking any medication, that tells me that you are focusing on the nutrition and activity to help control those blood sugars. Having that healthy, well balanced meal is definitely going to help keep the blood sugars more stable. The more carbs you eat, the higher your blood sugar is going to go. Um, when you think about, how does that food break down? When you look at that plate method that we were talking about, the protein is not going to be the first thing that your body's going to use. It's going to be those carbohydrates, so those starchier vegetables. Um, that's going to have a quicker rise to your blood sugar, but it doesn't keep that blood sugar up. But it's your fast source of energy. It's what your body is going to use first. And then you've got your protein, which takes a little longer to kind of kick in and turn into a source of energy, but lasts longer. So it's your longer source of energy. And then your non-starchy vegetables, I think some people do try to count them and figure out how they have an impact on the blood sugar, but you really would have to eat a lot of the non-starchy vegetables for it to have a big impact. But they're also full of nutrients that your body needs to be healthy. Um, but you want to consider, how are those foods affecting your blood sugar? So maybe you're not on medicine, and oftentimes when we're not taking medicine, the doctors don't necessarily even discuss blood sugar monitoring. But even if you are managing with nutrition and activity, having the tools to be able to monitor your blood sugar would be so helpful, because you can see where you're at before the start of a meal, then check your blood sugar 2 hours after that meal and see, how did it affect your blood sugar? Did I have maybe too many carbs because my blood sugar is higher than what I'd like it to be? Or maybe it didn't move hardly at all, and maybe I can give myself a little grace and eat a little bit more if I'm really restricting my carbs. And there are some people that like to be on more of a low carb diet in general, but if you're at least consistent with your carbs, you're going to have a more stable, steady blood sugar level. And if it's at a level you're comfortable with, your doctor's comfortable with, then you wouldn't require the medication. Now, if you're doing all those things, and no matter how healthy you're eating and how much activity you're getting, and your blood sugar still continues to rise, then that might be a time to have a discussion with a provider about those medication options. But if you don't need the medication, that's awesome. And keep up the good work, and definitely take advantage of the resources to help you maintain that. Any other questions? I hope I answered that one okay. You are welcome. You're welcome. Any other questions? Well, I appreciate everybody coming and for attending, and hope that this was helpful information. Um, at least give you some talking points with your provider. And there are some other options for more support there on the screen if there's anything that you might be interested in writing down.
All right. Well, thank you so much, Michelle, for so much good information um, about the diabetes, mastering the essentials. And thank you, everybody, for joining us today. I hope that you enjoyed the presentation and got some good information. Like she said, some good talking points you can take to your next doctor appointment, or, the next time your health coach calls you from Cecilia Health. Or maybe there's a question you think of later tonight as you're kind of thinking back on the presentation. Definitely can bring up with your coach or your physician. So we appreciate your attendance and participation, and hope to see you at the next webinar. All right, thank you. Bye-bye.